Passion is in the air, and really very thankful to the Funding Network for giving us this opportunity tonight to present. It was an offer I couldn't refuse, even though it's my wedding anniversary today. But I feel equally passionate about this project, and compared with my marriage and my wife, because she's our clinical director and she's equally passionate about this project as well. And we're meeting for dinner at 9:30. So, One2One Children's Fund is a small charity. We operate in Finchley. I'd like to introduce Natalie Renaud, who's our program director, who's spent time in Africa, who corresponds with the clinics, who's on the phone to the clinics virtually every day. And Natalie works 4 days a week. We're trying to get her up to 5 days a week, and she's our fullest paid employee. We have many volunteers and professionals who give of their time. So we have a very narrow base, but we have a big project base. I think we punch way above our weight in the accounts. And the special ingredient that we bring to the table is leverage. And leverage, because what we do is we create models in the areas in which we operate, and we then use those models to replicate and to encourage others to come in and co-fund and expand ourselves. We started our HIV work in Africa in 2002. I went to visit the Groote Schuur Hospital in Cape Town. No antiretrovirals, no government funding for antiretrovirals, and talked to the pediatrician, and we I said, what about antiretrovirals that I hear about? He said, well, not on the government service. We can't provide them. I said, well, what about if I got people from London to contribute? And we went on treks and sponsored events and events like this, and we put together the funding to treat 250 kids, which we did behind the government's back under a research program at the University of Cape Town, and that was the model that eventually the government adopted and have taken it out, rolled it out to thousands more children. And that model served as the basis for this expert patient program, because we brought other clinics from Africa down to Cape Town to see this model in action. And we realized that, it's not us saying this is the great model and the model is how to treat children with antiretrovirals, and how to do it in a way that is going to have an impact on their family, on their communities, on their nutrition, a holistic model of treatment, what we call comprehensive care. So bringing these other clinics down, you suddenly tumble to the idea there's so much to share. Let's share experience and knowledge, and out of that came this network organization of clinics called PATA, Pediatric AIDS Treatment for Africa, and there are now over 100 clinics in this network. We have annual forums in Africa where we bring together, the maximum we've been able to bring together is 45 clinic teams, and a team is a doctor, a nurse, a counsellor, and a pharmacist, and a nutritionist, and we encourage them to work as a team. They haven't maybe worked as a team in that way before, and out of this forum week comes, we bring them together, they share their knowledge and experience, and out of that comes recommendations of best practice at all levels, whether it's second-line treatment, whether it's how to deal with TB, whether it's the problems we're now having with adolescents, kids who were treated before are now adolescents, how do we deal with their life skills problems, sexuality, that type of thing. And you can imagine 45 doctors, 45 nurses, counsellors, pharmacists, coming together and saying, this is how we do it. Have you tried this? And out of that whole process comes best practice. And these clinics then take on the tasks. Now, one of these items of best practice that came through was, what's the problem? The problem is, we're a clinic, we're taking on 300 to 500 patients, new kids every year. Where are we going to get the doctors and nurses to do this? So the solution they came up with, let's train some of our patients. The technical word is task shifting. Let's shift the tasks along the line. Let's get these patients to do this work. And this is what this program is all about. It provides patients with self-esteem. They suddenly, from being stigmatized in their community, are role models It breaks down that stigma in the community. They provide all sorts of services in the clinic, whether it's reception duties, whether it's counting pills in the pharmacy. They get paid $60 a month, £40 a month for this. We train them, they're recruited, they're trained. And One2One Children's Fund has now, up till March this 2010, in this current financial year, we have 47 clinics with each with 4 patients. So 200, almost 200 patients that are being funded by this small charity in London, and it's spreading through the community. And the answer for combating AIDS and community health care in Africa in the future is paid community health workers. That's the only way to do it, and they need to be trained properly, and there's a ripple effect in the community and in the clinic. And that's what we do, and that's what we'd like you to support. It costs £2,500 per annum per clinic for 4 expert patients who often go on to become full-time employees paid by the government. Thank you.